Welcome back to Your Health television program. I'm Dr. David Morwood. I am a board-certified plastic surgeon, and I am delighted to have you with us today. And I'm delighted to welcome my first guest, the distinguished Dr. Patrick Wong. Dr. Wong is board-certified in physical medicine and rehabilitation. Dr. Wong, thanks so very much for joining us today.
Thank you for having me.
Dr. Wong, before we get into this very important topic of nerve conduction studies and electromyography, let's talk a little bit about your training and what you do and your average week.
Okay.
So tell us where you train, Dr. Wong.
So I did my physical medicine and rehabilitation residency training in Baylor in Houston. And then I spent an extra year where I focused on electromyography and nerve conduction studies and sports medicine at Hospital for Special Surgery in New York.
Okay, HSS. Mm-hmm. Very prestigious program. So you did, can we say fellowship?
Correct.
So you did
yes.
a fellowship in the sports medicine and electrophysiologic studies.
Correct.
Oh, great. So you're an expert in this. You're a perfect guest to talk about these things. So you are now part of a group in town here in Monterey, Monterey Spine, right?
Correct.
Monterey Spine and Joint.
Yep.
And you're on the sort of Ryan Ranch, Upper Ragsdale complex off 68.
Correct.
So tell us, Dr. Wong, what your average week is like. What do you do during the week?
So my average week is I'm in the office seeing patients and evaluating patients who have neuromuscular complaints or injuries, and I diagnose whether or not their problem's a musculoskeletal problem or maybe a neurologic problem, and I kind of formulate a treatment plan for them.
Okay, so what sort of patients do you see? Do you see young athletes with musculoskeletal problems? Do you see older people with arthritis or who may need a total joint replacement? You see people with spine problems? What's your population that you see?
I would say it's a mix of all the three. I do see a lot more back pain patients and a lot of patients who have pain from their back, but they also have numbness and they have tingling in their legs sometimes, and they have tingling in their hands. But I also see athletes too who may injure themselves who also have pain and also numbness in some cases, or weakness.
Okay. Dr. Wong, you know, what I think is one of the great advantages of your group is that you have multi-specialty care, multidisciplinary care. So you may see someone in your office that needs surgery, and you can refer and follow that patient, but you also see people that you believe will not benefit, at least at that time, from surgery. Isn't that correct?
Correct.
So let's talk about this huge topic of electromyography, nerve conduction studies. I think we can put that under an umbrella term of electrophysiologic studies, right?
That is correct.
So let's start by defining what we mean by electrophysiologic studies.
Okay. Basically, these electrophysiologic studies look at the function of nerves and the physiology of nerves. When somebody has a nerve injury, you want to determine whether or not the injury is conducting their electrical signals correctly. And that's what these studies would actually look for.
Okay, so we know that in our body, the somatic nerves,
Correct.
they originate in the spinal cord.
Correct.
Within the vertebral column. Every nerve in the body, in the somatic portion, the nerves originate in the spinal cord. So, for example, the longest nerve in the body is the sciatic nerve, correct?
Correct.
So that nerve cell actually starts in the spinal cord.
That's correct.
And it runs out the pelvis and down the thigh and down the calf to the foot. That's one cell. So sometimes we want to study how the conduction is from the spinal cord down to the foot.
All the way to the toe sometimes, yep.
Okay, so and now what sort of problems would you see in the arm? I think our audience may be familiar with what I just talked about, the sciatica, the irritation of the sciatic nerve. But why would someone need a nerve study of their arm or hand, for example?
Well, there are two very common conditions that people have in their arm or in their neck. And one condition is a radiculopathy, which means that the nerve is being pinched in the neck, which goes all the way down to the fingertips. The second most common injury to a nerve in the upper extremity is an injury at the wrist called carpal tunnel syndrome. So an electrophysiologic study would help distinguish where along the pathway of the nerve the injury occurred.
Perfect. Now, Dr. Wong, sometimes the layman will say, I have a pinched nerve in my neck, or I have a pinched nerve in my wrist or in my shoulder. Is that more or less an accurate term to use? Is the nerve pinched?
In some cases, the nerve is actually compressed, either by swelling or by an actual bone spur, or maybe from a ligament. But in some cases, nerves can be swollen just from inflammation. So that can also lead to nerve injury as well.
Okay, so for example, a real life situation, I saw an older gentleman in my office last week. He's about 65, and he said that lately he's noticed his thumb, index finger, and middle finger don't have very distinct sensation. He has a hard time distinguishing objects, and he's gotten to the point where at night, oftentimes he'll wake up and he feels he has to kind of shake out the numbness out of his hand. Does that sound like something that we need to figure out more about what's going on? Could you see a patient like that and help diagnose that?
Yeah, that's a very, very common symptom that people who use their hands a lot will complain of that. And unfortunately, both carpal tunnel syndrome, which is a compression of the nerve at the wrist here, has the same symptoms as somebody who has a pinched nerve in the neck as well. And so it's important to see a patient like that and do electrophysiologic studies, because it can help distinguish whether or not the nerve is being pinched at the neck or at the wrist.
Okay, perfect. So Dr. Wong, we're going to explain to our audience the difference, well, I should say, in electrophysiologic studies, there's the muscle study, which is an EMG.
Correct.
And then there's the actual nerve study, which is a nerve conduction test or nerve conduction study.
Correct.
So let's distinguish between the two, and then we want to talk about how the test is actually performed.
Great. Yep.
So can you tell us the difference between the EMG and the NCS?
So when people refer to nerve conductions, they refer to the first part of the test. The first part involves electrical stimulation at the wrist using an electrical stimulator. And the electrical stimulator actually sends an electrical signal into the fingertips. And the test is usually started at the wrist. The signal is also stimulated at the elbow as well. So that's the nerve conduction portion, which studies the actual peripheral nerves. The EMG, or electromyography part of the test, is using a needle that checks some of the muscles in the arm to see whether or not the muscles show signs of abnormality.
Okay, so do you put on, you mentioned for the muscle part of the test, you insert a needle. Is that painful? Does it hurt? Is it tender? Do people feeling shocked? So they feel like they're getting electrocuted?
Right. The electrical stimulations feel like a small static shock, slightly stronger than that. Most people can tolerate it really well, and it doesn't really feel that painful. In some cases, it might actually cause twitching of the muscles because the electrical activity is going to the muscle, it contracts. The needle portion can feel a little bit more uncomfortable, but the needle is a very small needle, similar to an acupuncture needle, and so most people can tolerate it pretty well. It tends to be a little bit more sensitive in the hand because the muscles in the hand are very sensitive, but as the needles are checking the muscles in the arm, they tend not to be as painful.
So Dr. Wong, are you able to distinguish, let's say someone has numbness in what we call the median nerve distribution of the hand. They have numbness in the thumb, index finger, and middle finger. Can you distinguish if their nerve is pinched or compressed at the wrist, or maybe in the antecubital fossa near the elbow, or pinched or compressed in the shoulder or even the neck? Are you able to study that?
Yes. With the nerve conductions, or the electrical stimulation portion of the test, you can stimulate the nerve all along its pathway. And when you stimulate it past the area of compression, you can see whether or not there's a difference between one area versus another. And so you can also study it at the elbow too, above and below the elbow, or above and below the shoulder. Okay,
perfect. So more about the actual test. Do people have an anesthetic? Are they awake? Do they go to the operating room? Is it in your office? Is it covered by insurance? I guess I asked how long it takes. So some questions and answers about the mechanics of the test.
Yeah, it's a test that's typically performed in the office. There's no preparation for it. If it's a test of the arm, typically wear loose clothing, like a tank top or a t-shirt. If it's in the lower extremities or in the legs, I would wear shorts to just kind of expose the leg. Patients are typically lying on their back. The entire test takes maybe about half an hour. There's really no preparation that the patient has to do. If they feel uncomfortable lying on their back and they have any pain medications that they need to take to make themselves feel a little bit more comfortable, they can do that. Typically, I ask the patient not to wear too much lotion or any kind of perfume on the skin so that the electrodes can stick to the skin much easier and pick up much better electrical activity.
Perfect. Well, Dr. Wong, I have a question I'd like to know the answer to, is how you tell if the nerve is being pinched right near the spinal cord. In other words, coming out, let's say someone has a cervical disc disease and they come in, well, we don't know that they have cervical disc disease, but they come in with numbness in the hand. How can you tell if the nerve problem is at or near the spine?
So typically, if the problem is in the spine, the first portion of the test, the nerve conduction studies, should be normal, because the nerve conduction studies test the periphery, everything from the neck down. And the second part of the test, which checks muscles that are from a specific nerve, if those are abnormal, they direct the diagnosis towards a certain nerve. So certain muscles in the arm come from only one nerve in the neck. And so if only those muscles are abnormal from, let's say, the C7 nerve, that would indicate the problem's actually from the C7 nerve in the neck.
Perfect. Okay. So let's say you diagnose someone as having a pinched nerve or nerve, I guess the formal name is compression neuropathy. Let's say it's near the shoulder, at a fairly difficult place to get to surgically. Can you sometimes recommend physical medicine or physical therapy or stretching exercises or strengthen certain muscles around the shoulder girdle to try to take pressure off that nerve? Is that possible?
Yes, in fact, that's actually very common. Prior to doing surgery, we typically recommend doing physical therapy first, because there are certain muscles you can stretch and strengthen that may relieve some of the pressure on some of those nerves in the shoulder.
Okay. Dr. Wong, on occasion we will see a person with fairly long-standing carpal tunnel syndrome, and the muscles at the base of the thumb, what we call the thenar muscles, actually those muscles have begun to waste away. And we see that when people try to live with undiagnosed carpal tunnel syndrome, or maybe they've known about the carpal tunnel syndrome, but for various reasons have not had surgical decompression.
Correct.
Now, what can we tell those people about their chance of recovery, regaining strength and full motion, if their muscles have wasted?
So the portion of the test, the second portion with the needles that check the muscles, can give a good idea of how severe the injury is. And so based on how severe the injury is on the second part of the nerve test, you can kind of get a sense of what the prognosis is. If there's atrophy or wasting of the muscle in the thumb, typically the prognosis is pretty poor. That being said, you want to kind of catch carpal tunnel early so you kind of prevent from getting to that stage. That also kind of reflects the fact that if we've gotten to that point where it's a severe injury, typical treatments like injections or bracing typically won't work and surgery is necessary.
Sometimes I think that it's a smart thing to tell our patients, or it's good advice to tell people, that sometimes the point of surgery is to prevent a condition from getting worse. Isn't that correct?
That is correct.
So whenever we can interrupt that process of a nerve being squeezed or pinched, it's a good idea to decompress the nerve, allow it to breathe, and at least we can prevent further damage.
That's correct, yeah.
Now, Dr. Wong, on occasion I will see, say, a carpenter mistakenly having a very difficult injury, may have a skill saw or saw go across the forearm, for example, and a nerve can actually be cut. So it's not that it's being pinched, and even though we put the nerve back together under the microscope, that there's not an immediate return of function, and that I will send the patient to you for electrophysiologic studies, and those can be very helpful. Can we talk about that a little bit?
Sure.
And let's talk about what we can tell the patient and why we can sometimes do electrophysiologic studies after an injury.
Well, Depending on the location of the injury, the nerve can sometimes either be temporarily crushed, which tends to have a better prognosis than if a nerve is actually severed. If a nerve is actually severed, we can test along the pathway of the nerve to see where the location of the nerve was actually severed. And then if you perform surgery for it, you can retest it again to see if the connection past the area of surgery allows that connection to reoccur. It's also a good test months after surgery to kind of check on the prognosis and the status of the nerve.
Excellent. So oftentimes I find we can give patients very valuable information about the biochemistry and the physiology of how they're recovering, which can be very valuable. Very valuable. So, Dr. Wong, we only have about a minute left, and I'd love for you to come on the program again. You're a great teacher. What I'd like to do is give out your contact information, and then I'd like to talk a little bit more about the mechanics of the electrophysiologic studies, and in case someone is interested in getting someone, how they arrange for that.
Sure.
So, Dr. Patrick Wong, you're board certified in physical medicine and rehabilitation, MontereySpine.com. And do you have a phone number we can give out?
Yeah, it's 831-648-7200.
Okay, 831-648-7200. Dr. Patrick Wong, you're board certified, and you did a fellowship in electrophysiologic studies and sports medicine, so you're good at doing the EMGs, nerve conduction studies, etc. So again, I'm not sure if we talked about the preparation or having one of these tests done. Do they need to see their family doctor and get a referral? Is it covered by insurance? Can people call and just talk to you because they have a numb hand? How's that work?
Yeah, they don't necessarily need a referral. It's typically covered by all the major insurances, including Medicare. And if they have any numbness, they should just make an appointment. You don't necessarily need to have a referral from another source.
Dr. Wong, one more question before we go. What about, this is a whole other issue, please come on again and talk about this. What about the diabetic patient with a peripheral neuropathy? Let's say they have what we call stalking distribution of numbness.
So it's very common after years of having diabetes that people develop numbness in their feet, and that's one of the earliest signs of diabetic neuropathy. Nerve conduction studies are very helpful in distinguishing whether or not the nerves have lost their ability to sense, because nerves are made up of two portions, a motor portion which controls muscle movement, and then another portion that controls sensation. And so this test is great at distinguishing how much of the body is affected by peripheral neuropathy and what parts of the body are affected.
Dr. Patrick Wong, that's a perfect segue to allow me to invite you to come on the program again and teach more about peripheral neuropathy and nerve conduction studies, etc.
It'd be my pleasure.
Okay. Once again, I'm Dr. David Morwood. I'm a board-certified plastic surgeon, and this is Your Health television program. We're going to take a very brief pause for a very good cause.